Hello and welcome to my channel. This is Isaac Sn2ep12. Thank you for tuning into my channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like and share. This is a channel where we should talk about issues concerning averting HIV and sexually transmitted infection stigma in our society. And we usually say that being positive about HIV is not necessarily being HIV positive. Thank you. Today we are going to discuss yet another opportunistic infection associated with HIV infection, and in our discussion today we'll be talking about a fungal infection that we call Coccidiomycosis. Other people call it valley fever, other people call it desert rheumatism. Thank you. Basically, uh, this kind of fungal infection is an airborne disease that is usually caused by a fungi that we call Coccidioides. Have you ever heard of that? Okay, let's learn. Now, Coccidioides they releases some spores like any other fungal or any other yeast cell. They release spores in the air. These spores, when you inhale them, they will either land in your throat or directly to your lungs. For the immunocompetent individuals, these are the persons with good immunity. Most of them, or a higher percentage, the infection is usually asymptomatic, and they do not require a lot of treatment or antifungal agents to be able to relieve the infection. However, for the immunocompromised individuals, these are the persons who are either HIV infected with low CD4 count or are cancer patients whose immunity has been compromised already. The infection may become severe and disseminated in other parts of the body. Now, the incubation period of this kind of infection is usually between 1 week and 4 weeks after the exposure with the fungi or the fungal spores. Are we together? Thank you. Now, let's discuss the presentation. For the mild presentation, the patient will present with flu-like symptoms. These are the likes of cough, mild cough, chest pain. They may present with runny nose and sore throat and mild fever. However, in severe presentation, especially for the immunocompromised individuals, they may present with severe pneumonia symptoms. These are the likes of difficulty in breathing, sputum, blood-stained sputum, pruritic chest pain. They may also present with a cough. Are we together? For the disseminated case, they may present with osteomyelitis. Other persons may present with even meningitis secondary to coccidiomycosis. Are we together up to that point? Thank you. Now, how do we come up with the diagnosis of someone who is suffering from coccidiomycosis? And before we go there, the differentials of someone who is suffering from coccidiomycosis are the likes of community-acquired pneumonia. Can be able to confuse it with community-acquired pneumonia and tuberculosis and carcinoma or tumors of the chest and the bone or of the brain because of the kind of presentation. Now, how do we come up with a diagnosis of someone who is suffering from coccidiomycosis? There are various diagnostic modalities that you can be able to employ. First one include a chest X-ray, whereby in a chest X-ray you can be able to observe proliferation, nodular lesions on a chest X-ray film, or opacification or cavitations can be observed on a chest X-ray. Other diagnoses that can be done we can be able to obtain a sputum for Papa Nicolau or Glaucot methenamine silver staining. We can be able to do a PCR, tube precipitate acid, and other include the enzyme immunoassay tests. Are we together up to that point? Thank you. However, to be able to confirm this kind of diagnosis, it's always very good to link the presentation, the history of travel to an coccidiomycosis endemic region, and a positive diagnosis of this kind of infection. That is the laboratory diagnosis. Are we together? Thank you. Now, let's talk about treatment. For the uncomplicated coccidiomycosis, we can be able to use antifungal agents. These are the likes of itraconazole, posaconazole, or fluconazole. Although for fluconazole, it is highly preferred in the treatment of coccidiomycosis meningitis. Are we together? Thank you. Also, for the complicated coccidiomycosis, you can also use the IV amphotericin B, which is also effective in the management of coccidiomycosis. Are we together up to that point? Thank you. Now, let's talk about prevention. Remember, prevention is better than cure. Now, to be able to prevent this kind of infection, it's always very good in case of an outbreak or in case of someone who has been diagnosed with this kind of infection. It's very important to notify the public health department so that they can be able to do a good surveillance of the environment and be able to do a good education and also sensitize the community, because an airborne disease, to prevent it, it's a bit difficult. But when you have notified people and those who have been contacts screened properly, you prevent the spread of this kind of infection. Are we together up to that point? Thank you. Also, for those who are HIV positive, it's always good to start your treatment very early so that you can be able to sustain your immunity optimally and be able to avoid the severity of kind of infection in case it occurs to you. Are we together up to that point? Thank you. Thank you for watching this channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like, and share. This is Isaac, simple and real. Bye bye.